Hi, everybody. You are listening to the Medea podcast series. Medea Medical Education Academy is a global medical education provider dedicated to designing, delivering, and evaluating medical education programs worldwide. Today, we will be speaking with Julio Rocha, Professor of Nutrition and Metabolism at Nova Medical School, teaching in the field of nutrition and metabolism. At the end of this podcast, learners should be able to recognize the impact of exercise on health of patients with PKU and identify the potential benefits of exercise for optimizing metabolic health in PKU patients. This podcast is part of the continuing medical education program entitled PKU Blended Learning Journey 2025, targeting specialists in paediatric and adult inherited metabolic disorders, dietitians, nutritionists, clinical biochemists and geneticists, basic scientists, psychologists, gynaecologists and obstetricians, nurses and all healthcare professionals helping those with PKU. All materials will be suitable for all geographic regions.
Hello, my name is Julio Rocha. I am a professor of nutrition and metabolism at Nova Medical School, and I'm also a nutritionist at one of the reference centers for inborn errors of metabolism in Lisbon, in Portugal.
Can you describe the health problems that are more prevalent in those with PKU compared with the non-PKU population?
Thank you very much for the question about the main problems that affect patients with PKU. In fact, as we know, PKU is caused by a defect on the liver enzyme phenylalanine hydroxylase, giving rise to an increased amount or concentration of blood phenylalanine and reduced concentration of blood tyrosine. As a consequence, these amino acids, by sharing the same transporter into the brain, they will give rise to also imbalances in the brain. So, what I would like to say with that is that the main physiopathology of PKU is located in the brain, but I will not discuss that in detail because I presume this will be a topic for other podcasts. But apart from the brain, apart from neurophysiological alterations that patients with PKU may be faced with, I would like to highlight that in the last years, more and more, it has been highlighted that other organs may be affected. One of those organs may be the bone, that due to a special nutrition environment, to a special diet, may be in some way affected, or even by a direct consequence of the disease. Anyway, at this moment, the meta-analyses that have been published do not demonstrate a real risk for bone defects in patients with PKU. Patients with PKU usually manifest a lower bone mineral density in comparison with controls, but usually this is not on the red zone, I would say. It's not immediately saying that these patients are at an increased fracture risk. On the other hand, besides bone, I would like to highlight also overweight and obesity, because in two prevalence studies that have been published in 2018 and 2019, respectively in the USA and Germany, both studies highlighted that patients with PKU, or in other words, if I would say it, overweight and obesity, are more prevalent in patients with PKU in comparison with general population. Together with that, the same studies also highlighted that dyslipidemia and in some way hypertension, metabolic syndrome could also be increased in patients with PKU. The bottom of line is that these two studies combined early treated patients with PKU with late treated patients with PKU. So, in conclusion, we cannot disentangle the effects of the disease on these etiological mechanisms, or to understand if these comorbidities are more related with the PKU treatment, mainly a fee-restricted diet that is supplemented with protein substitutes and special low-protein foods. In fact, when we go to the literature more recently, a lot of publications have been highlighting the risk of overweight and obesity, increased insulin resistance, the risk of dyslipidemia. Again, the bone health has been highlighted, and also the kidney disease. But the recently published guidelines, the first revision of the PKU guidelines, we were unable to write based on the scientific evidence that there is really a problem regarding bone or kidney, or if you would like, also in other organs like the heart, the eye, or, as I said, in the bone. So, as a consequence or as a conclusion, we need to keep our PKU patients continuously under follow up in order to adopt strategies to prevent comorbidities to appear. At this moment, we are unable to say that any comorbidity, overweight, obesity, hypertension, any impact on kidney function, dyslipidemia, insulin resistance, eye problems, we are unable to say that these are strictly related with the disease itself or with its treatment. So we need to prevent, to optimize treatment in order our patients can have the best outcome as possible.
Are there particular reasons for the PKU health profile?
Thank you very much. The particular reasons for the health PKU profile, in my opinion, are mainly related with the follow-up management. So we need to understand that in the last decades, with the implementation of newborn screening programs across several countries, even though still, unfortunately, some countries do not have yet their newborn screening programs, the majority of PKU patients are diagnosed in the neonatal period, which means that we are able to start treatment in the neonatal period, avoiding neurological sequelae to be on site. Based on that, we need to recognize that not particularly during the first year of life, but from the second year of life, first infancy, school age, particularly adolescence, compliance with the fee restricted diet is very hard to be fully maintained. And even when chaperone treatment is available in some countries and implemented, what we know from the meta-analysis and systematic reviews is that not all patients respond to this treatment and not all patients are able to eliminate the food and nutritional restrictions. Based on that, we have always a big problem in my point of view. Because if you have a disease, if you have a treatment, and if the efficacy of that treatment is 100%, allowing patients to be compliant with that treatment, you are more able to restore physiology and to understand if metabolic clinic consequences are related with the natural course of the disease or are in some way related with its treatment. But in PKU, we still do not have that type of studies. We do not have yet patients with classical PKU, the most severe form of phenylalanine hydroxylase deficiency. We do not have those type of patients that were diagnosed and treated, getting physiological Phe levels throughout their life cycle. So we are not able, when we are measuring comorbidities and health issues, as you were mentioned in the final adolescence or even in adulthood, we are not able to say with 100% confidence that these health issues are related with the disease, with increased Phe levels, or are merely consequences of a Phe restricted diet that limits the ingestion of several food categories that will give important nutrients, bioactive compounds that, of course, will impact our health in general. So we are not able at this moment to say what are the reasons. One thing we know, the more the patients are non-compliant with the Phe-restricted diet in combination or not with drug therapy, the more uncompliant the patients are, the more impact we will have on executive function, one of the neuropsychological aspects that can be altered in patients with PKU. And these patients who have imbalances on their executive function will have even more difficulty in trying to optimize their dietary and treatment compliance as a whole. And at the end of the story, we will have really, really difficulty to understand what were the reasons, what were the main causes for a particular comorbidity that a patient with PKU was faced with. So again, we need, as reference centers, all treatment centers, in my opinion, we need to keep all PKU patients, independently of being under treatment with diet plus a drug treatment, we need to keep all these patients under follow-up in order to better and better understand the course of this population and to better understand whether these health issues are more related with the disease or more related with its treatment.
Are there any known physical restrictions to exercise for those with PKU?
Yeah, physical exercise has been recognized as an important strategy to help patients with different conditions to increase their health status. There are very few publications addressing the topic of exercise in PKU. The few publications that have been published do not show an acute, significant impact of acute exercise on blood Phe or blood tyrosine concentrations. But the fact that even though these patients, these studies are unable to demonstrate this acute impact, we cannot say at this moment that the impact may not be there because it has not been deeply studied. But from the literature that we have at this moment, there are no reasons to restrict physical exercise to patients with PKU. There are some studies showing that patients with PKU tend to be more sedentary. They tend to perform less active than their peers, controls. And even though the basal metabolic rate seems to be similar to controls, there are studies showing that mean physical activity levels are lower in patients with PKU, and energy expenditure are also lower in patients with PKU. But very interestingly, the patients with PKU with worse metabolic control, those who are less compliant with the treatment, those patients tend to have lower capacity to have an optimal or better workout exercise. So again, we need to press the button on the compliance. We need to press the button to keep our patients under good metabolic control. And with that, I think, and going back to the first question, I think exercise should be seen as an excellent strategy to promote society, to organize the hunger and society balance, to prevent these patients to get overweight, to prevent these patients to get insulin resistance, to optimize protein synthesis and calcium sequestration into the bone in order to promote bone accretion throughout the first 25 years of life. So instead of trying to keep the eye on what is the bone mineral density in adults on the fourth or fifth decade of life, we need to press the button on adolescents, children, adolescents, young adults to promote exercise in order to promote healthier bones. On the other side, we need to keep in mind that the exercise is able to stimulate the activity of adenosine monophosphate kinase, which is an enzyme that signals the need to increase energy output. And this AMPK is signalized both by anti-inflammatory cytokines like adiponectin and also by insulin. So we need to guarantee that our patients will keep a good insulin sensitivity in order they can get older and keep their metabolic health in a good patamar. So by other words, what I would recommend is that every single patient with PKU should be advised to perform regular physical activity. And why not? Those who are interested, those who have chance to do it, why not to be engaged in physical activity that can be a good, an excellent strategy to prevent overweight, obesity, insulin resistance, hypertension, and also lipid abnormalities that in patients with PKU, we still do not know whether hypercholesterolemia really play a role in this metabolic syndrome question because there are a lot of conflicting results. Just to finalize, in those patients with PKU that are enrolled in exercise, and particularly those who have some competition, who have some specific objectives with that exercise, there are already some publications trying to suggest what could be the adaptations on their diet, on their nutritional intake, in order to favor the best energy availability for these individuals to perform the exercise in a better way and to recover from the exercise in order they can be happy and healthy and prepared again on the day after.
What other measures could help improve quality of life for those with PKU?
Thank you for the question, because I did not mention quality of life as an outcome of the exercise. And of course, you are right. The exercise should be seen as a strategy to improve quality of life. And in the early years of PKU, I've been working in this field for more than 20 years, and I can remember the first patients I was able to see and to keep under follow up. The parents were so protective. So they were always trying to protect their kids, not performing exercise because if they will have a flu, if they have a respiratory infection, if they got fever, they will have, of course, a deteriorated metabolic control. The blood Phe concentrations would increase. So, in my feeling, I think that in the past, patients with PKU were not advised on a free basis to perform physical activity. And in some way, even worse, than to have a child, than to have an adolescent that sits together with their peers and will have a different meal, not allowed to take the same foods as their colleagues. Even worse is when my friend is playing football, is playing tennis, is riding a bike, and I'm not able to do it. I'm not engaged to do it. This is not the best way to live our lives. So I think the exercise nowadays, even though it can and it should be used as a strategy to optimize health, we need, of course, to use it as a natural strategy to keep our patients to feel as much as possible normal, to feel completely incorporated in the society, being part of the team of their colleagues at school, at the faculty, at their work. So I think that is really important. Apart from that, ourselves, clinicians, we really have a special task on this. We should not start any type of appointment, a pediatrician, a metabolic physician, a nutritionist, a psychologist. We should not start the appointment with our patients at the hospital just judging their blood Phe levels. We should not start by that because every single PKU patient, they are aware that their blood Phe control is never perfect. So we should not press that button forever. We should start asking them, what about his performance at school? What about his performance at work? How is your life? How are you coping with your stresses during your day-to-day life? And trying to understand their difficulties, trying to get an insight on their severity of PKU, on their comorbidities, on their treatment strategy. Only at the end, we will be analyzing, not judging, analyzing their metabolic control, trying to optimize it, but not judging the patient. Because sometimes there are minimal amounts of natural protein that our patients can intake, and this is enough to disturb their metabolic control. So we need to keep a good relationship with our patients. We need to try to motivate them. That's why the recently published PKU European guidelines clearly say that the minimum requirements in the metabolic team should be the metabolic physician, the nutritionist, and the psychologist. So, as much as possible, we need to give to our patients hope, to give not one hand, but the two hands in order we can take them through this journey in order the future can be better for them and not worse as in the past due to limited scientific evidence we were expecting to occur.
What take home messages do we have at the end of this podcast?
The main take home messages are that, of course, the first organ that is disturbed in patients with phenylketonuria is the brain. Apart from the brain, and of course, the disturbance is dependent on the severity and particularly the metabolic control that can be achieved. Apart from the brain, we may have, of course, an increased adiposity with overweight and obesity. We can have bone disease. We can have growth problems. We can have eye problems. We can have heart problems. But still, we do not know if really these problems really play a role and whether if these are related with the disease or with its treatment. Second point is that patients with PKU do not have any kind of restrictions for practicing exercise. We do not know, we can't recognize any contraindication to promote physical activity and exercise in patients with PKU. Number three, I would say exercise should be seen as an excellent strategy to prevent comorbidities, overweight, hypertension, metabolic syndrome in general, to occur in patients with PKU, and particularly in patients that are involved in sports activities. We need to optimize their nutritional intake in order we can optimize their performance. It's not because they are PKU that they can't win the race. They can win the race. And we need to give our patients their confidence. And because of this strategy, I will finalize with my fourth take-home message is that we need to give confidence to our patients. So we need to try to optimize their quality of life in a global perspective. We should not judge our patients. We should help them. We should nowadays recognize that more and more treatment strategies are available and we need to combine. We may have a specific patient that may fit very nicely with this specific treatment. And we need to be able to understand what type of patient we have in front of us to match with the perfect treatment. And with that, please keep your patients under follow-up. Please study every single patient as much as you can in order you can improve every single one. And in global, you can improve this population, trying to change the landscape of the future of patients with PKU.
Thank you for listening to this Medea podcast. For more information about our continuing medical education programs, please visit our website at medeaacademy.com.